Alrighty, so thank you everybody for joining this discussion today. So we're going to start off today by hearing from our friend Amelia Kirby. She is working with the Foundation for Appalachian Kentucky on a project that's focused on reducing the reliance on the system of mass incarceration in Eastern Kentucky and beyond. We're also going to hear from some Foundation for Appalachian Kentucky staff about how this work relates to the larger model of the Rural Development Hub concept, as well as some affiliate community foundation board members specifically on their work regarding their community-based initiatives to serve the most disproportionately affected people in their communities. So this conversation is also part of a series focused on criminal justice reform and serving disenfranchised populations. This topic has been very much influenced by the strategic investment plans that the affiliate community foundation boards have been developing and implementing over the past couple of years, in which board members have expressed a strong desire to serve vulnerable populations in their communities. I already kind of gave that Zoom reminder, but if you would like to kind of raise a comment or question, please feel free to unmute yourself. And I'm going to go ahead and turn it over to Amelia Kirby. And like I mentioned, she's working on this special project with the foundation, which she's going to share a little bit more about. She's from Wise County, Virginia, and she has lived in Eastern Kentucky since 2000, I believe. She has worked as a media producer, a small business owner, and an advocate for healthier, more just Appalachian communities. And I'm really grateful to have her here today.
Thank you very much. I'm really happy to be here with y'all and happy to see so many friendly faces. I would like to request everybody, y'all all may already know each other and have all your contact information you need, but if people would put their names and affiliation and contact in the chat so we can be in connection with each other as we need to be, I would love that, just so I can see who everybody is. Thank y'all for taking the time to be here. And as Jacqueline said, I'm from Wise County. I've lived most of the last 20 years in Eastern Kentucky and have spent a good bit of that time thinking and working on issues related to the criminal justice system. And most recently, in the last couple of years, I've been working with the Foundation for Appalachian Kentucky. The foundation received funding from the Chan Zuckerberg Initiative. I'm just going to give a little bit of background on kind of what this work is and got where we are. The Chan Zuckerberg Initiative, which is essentially the Facebook Mark Zuckerberg's family foundation. They've taken a significant interest in criminal justice issues in the last few years. And we're particularly interested in funding work that was happening in places that weren't necessarily the obvious choice for criminal justice work, looking at rural communities, looking at places that might not have been in the spotlight as much. And so the Foundation for Appalachian Kentucky was a natural fit on that front. But it's not work that we had a deep history in doing at the foundation. And so we were kind of starting a little bit from square one to figure out how did we want to conduct this work? You know, what was it going to look like? How are we going to roll out meaningful change on the system of mass incarceration in Eastern Kentucky with the systems that we have in place? So the broad mandate of the grant was, it was extremely broad. It's with the idea to reduce the system of mass incarceration. So that could take any number of forms, it could go any number of directions. And so we started thinking about, well, what do we have in place now? And one of the things that's in place through the Foundation for Appalachian Kentucky is this system of affiliate boards of community foundations throughout the region. So that is what many of y'all represent here. And so we were kind of thinking, we have this network of folks who may or may not have engaged with this issue before, but we believe that once people kind of learn more about the system of mass incarceration and how it plays out in our communities, people will kind of really reckon with this is a place that we need to put attention, work, and focus in our region, particularly as noted with the idea that this is a vulnerable population. And one of the things that can easily get lost in our thinking and discussing the criminal justice system is the framing of it's very easy to kind of frame folks as criminals they've made bad choices and that's that, and they should be locked up and we've got the answer, it's to lock folks, that's the end. When in fact, as soon as we start digging into it with any level of focus, you come to recognize that So many of the things that we identify as bad choices are really based in bad options. They're based in lack of availability for housing or good jobs, adequate healthcare. A lot of the things that make lives safer and more livable, in turn become the choices that people make that are criminalized, and they end up behind bars. So wanting to start from that premise. And then also, I think one of the things that we recognized early on was that the criminal justice system and the system of mass incarceration in a lot of ways is very invisible. It's a thing that you can kind of take for granted. Oh, the jail's over there, the prison's up on the mountain. It's kind of not something that, unless you are directly connected to it through your employment or through somebody that you care about who is in jail or incarcerated, it's very easy to not engage with it. Because of that, a lot of folks are not really necessarily aware of the fact that the United States has far and away the largest prison system in the world. We as a nation incarcerate 25% of the entire world's locked up population, just the United States. That's around 2.3 million people. 500,000 of that 2.3 million are people who are just being held on bail because they can't afford to pay their bail. So there's, 500,000 people behind bars right now who haven't been convicted of anything. They just can't pay bail. So there's like kind of these layers of invisibility, I guess you would say, around the system that we're all quite close to in one way or another, but we may not see. And Kentucky has the seventh highest incarceration rate in the country. So we're seventh in the country for the number of folks we as a state lock up. On top of that, Central Appalachia has one of the highest concentrations in the country of rural prison and jail siting. And Eastern Kentucky has nearly half of the prisons and jails that are in Central Appalachia. So it's a really concentrated issue in our region, in our communities, and it may or may not be something that we reckon with in our daily lives and our work and the systems that we're looking to affect. So I wanted to kind of give all of that broad context to say this is part of why we really are trying to build out deep engagement throughout the affiliate boards and throughout our communities to think about what these issues mean for our counties, for our region. So that was a lot of backstory. And one of the things I wanted to touch on also, just as a kind of like why, thinking about why does Eastern Kentucky have such a sort of major stake at some in this system. In part, it has to do with the decline of the coal industry. A lot of communities, when the industry started to decline, and for example, I'm from Wise County, Virginia. In the late 90s and early 2000s, the county leadership in Wise County recruited 2 super maximum state prisons explicitly to replace the jobs that were lost when Westmoreland Coal Company shut down. So there's a lot of kind of one-to-one connection with the decline of the coal industry and the rise of employment through incarceration. Double down on that with the state of Kentucky has 24,000 people in the state system, the State Department of Corrections, and they only have 12,000 State Department of Corrections beds. And so they're locking up about half of their folks. They're renting out beds in our local jails. And so that's something we see a ton of in Eastern Kentucky. And it's an explicit way for local economies, local county economies, to make up some money that they've lost on coal severance tax. And so it's kind of a stopgap for local economies. But it then binds our economies to the system of incarceration. And it I think there's both some moral questions about, is that what we want for our communities? But it's also just economically a challenging prospect to have your economy built on incarceration. So I just talked a whole bunch. Do people have questions or comments? I definitely want this to be a conversation, and we've got folks from Floyd County, we've got folks from the I'm going to call as we go forward to talk a little bit more about what we've got going on, but pause for responses. All right. Feel free to jump in at any point. I certainly I want this to be a conversation. So that brings us to Floyd County, which is where, as we were considering how did we want to roll out really engaging deeply with these issues, one of the strategies that we decided on was to do a pilot project with one of our affiliate boards, with one of the community foundation boards, to both engage around the issue, right? Like, what does it take to actually really have a deep and broad community conversation in a particular place around the issues related to the system of mass incarceration? And then how do we work together as a community to build strategies to start addressing those issues? And so in Floyd County, we went to the community foundation and said, are y'all up for this, for being part of this pilot program? And we would like to have these conversations, but also we would like some grant making in Floyd County. And we want a system by which the community is really figuring out what are the issues, what are the strategies, what are the tactics we're going to use, and where do we want to direct funds to actually make some change in our community. So there are several people here from Floyd County that I would like to call on to talk a little bit about what those kind of first conversations were like. And I wonder if, Evan, I'm just going to put you on the spot, if that's okay, to give your reflections of kind of the initial days of our pilot project in Floyd
County. Sure. I think Amelia gave a terrific introduction there. I'm not sure that I would nominate myself to be the first person to talk about this from the Floyd County perspective, because it certainly didn't begin with me. But I'll say that I come at this from, we all wear many different hats in the, towns that we live in and the ways that we come to this work. And the two main hats that I come at this with is, on the one hand, I'm a member of the Floyd County Community Foundation. I'm on the board there, and I've been involved for, I don't know, 5 or so years. I'd have to think about exactly when that began, but in terms of going back a little step further, as I tend to. I mean, of course, John Rosenberg was very involved in getting that set up, along with some others that, including some people that are no longer with us. But in any case, so I've been involved with the Floyd County Community Foundation, before this work began. Again, and that work is, as I think many of y'all are, we're interested in building up a local endowment and generally trying to support a variety of community-based efforts that are going to make the place that we live better for ourselves, our children, our neighbors, etc. So in that sense, just very basic, bread and butter type things. The other way I come at this is, I am an attorney. I work at Apple Red Legal Aid. I don't do any direct criminal justice work myself there. We just do civil work. But it's really impossible to work in the justice system in really anywhere, but certainly in our region, and not see the effects of the criminal justice system. It affects our family law cases. It affects, really just kind of up, down, left, right, all over. You see how the criminal justice system affects, ourselves. And again, just as someone who, I grew up in Whitesburg, I live just outside of Prestonsburg here. Again, we all know the way that, so many people's interactions with the criminal justice system affect just our everyday lives. So that's just a little bit of the background of where I come at on this. And so when the potential came up that there might be some funding available to just see what we could do in our small community, to both help some people here locally and also learn what we might be able to do in some other communities, I was really excited by that. And so we started from a very, I'd say, conservative approach. I don't mean that necessarily in a like political sense of, are you blue, red, or somewhere in between. I mean it just from a sense of like, all right, let's start with some kind of minimal interventions that we think wouldn't push anybody away. And so There's, we can talk more about the directions the specific interventions that we've chosen to make, kind of what's going on with those. But I'll just kind of briefly say that we've sort of thought about this as a three-legged stool, with the first piece of that being that we want to have basically a social worker who's going to be able to work with people in the Floyd County Jail. And I'll say that we're also interested in the state prison that's in Wheelwright that reopened as we were working on this. But anyway, that's been a bit of a different conversation, and we can talk about kind of the county versus state systems at some point if that would be useful. But we've particularly focused on the Floyd County Jail. And so we wanted to have a social worker that could help people with kind of the whole set of issues that come as people are looking at when they get out of incarceration, what's their life going to look like, and what can we do to make it less likely that they're going to have to be reincarcerated. We also wanted to have a civil attorney that would work at my office at Apple Red, that would think about what are some of the legal layers that are standing in the way of people as they get out. And then the last piece is we're interested in having a research component of this. As I said, while I'm very excited as someone who lives in Floyd County to do some work that helps my neighbors here and makes the community a better place, I think what we're really interested in doing is what can we learn from what we're doing here in Floyd County and maybe have a larger impact. At where I work at Apple Red Legal Aid, we have a 37 county service area that covers most of southeastern Kentucky. And I'd really love for this to be a true pilot project that expands and be able to cover more places. But with the funding that's available, if we had spread it too far, it just wouldn't have done anything. So, this social work, legal work, and research work, those were the three legs of the stool that we decided to focus on. And we certainly have had some other ideas, and we've had a long series of meetings that are fueling some other thoughts, but that's kind of the core and the basis of what we've done. And I'd be happy to introduce some of the actual feet on the ground of that stool, if that would be useful to do so, or we could also talk a little more big picture.
Thanks, Evan. That was an excellent summary of the work that y'all have done in the grant making process with the Community Foundation. I would love to hear from Casey and JR. I want to keep just a big picture just for a moment longer, and then I'm going to invite them to talk about the tangible day-to-day work that they are doing that have such incredible outcomes already. But first, if I could call on Suzanne. One of the goals of this model that we're using is to really build out engagement at a community level and bring in stakeholders, kind of traditional stakeholders, and then also folks who may or may not have been actively involved in kind of community decision making to engage with the issue. And I feel like, Suzanne, you have been part of these conversations from the very beginning and a very important voice in the room and in the work that we've done. And if you wanted to reflect a little bit about the process of kind of bringing in different voices and getting people connected to the issue.
Sure. Let me give you a little bit of my background. I have a master's degree in business administration, but the specialty in that is entrepreneurship, which of course is about innovation. And innovation is, looking at a problem or an opportunity in this case from different angles and looking at, what needs aren't being met, what needs are being met. Can we approach this from a process standpoint? But ultimately, one of the things that was important and has been important about the research aspect of this has been being able to have what we do be driven by data. So the hope also with the research project going forward is that we're going to identify things that maybe have not been looked at in the past by utilizing this really hands-on information that we're getting from the two people who are on the ground to give us a direction of really better meeting the needs of the individuals who find themselves incarcerated. Also, I think it's, important to, I also help volunteer and am involved in the addiction community. And, there's a lot of great information, particularly in, for example, 12-step meetings that could be gathered to sort of see, okay, what things happen that actually get a person to this point. Clearly they're not getting their needs met, ergo the need to be outside of our social constructs. But what are those needs that aren't getting met, and are there patterns that we can see? And again, part of an innovation process is bringing in viewpoints that are very different than the eyes that have been on a particular problem. Social workers, lawyers, other people in the legal and criminal justice system. My lens of it is very, very different than John's lens or Evan's lens or Amelia's lens, simply because we're looking at it from we're all looking at the same situation, but we're looking at it from different points in the room, so to speak.
Absolutely. And I think that that really gets to, thank you, Suzanne, that really gets to one of the core values of this approach is really bringing in different voices, bringing in different perspectives, different skill sets, and building together towards a shared goal. Even if we don't all necessarily even agree on every aspect of that work or every aspect of the origins of the need for the work, the ways that we've seen in Floyd County, a bunch of different folks come together and really dig in and make pretty quick, pretty immediate, real change. And Suzanne, as you articulated, really looking at the needs in people's lives that lead to what we call justice involvement, that absolutely kicks it right over to Casey and JR, who are on the front lines every day working with folks addressing those needs. And I wonder if either or both of y'all want to jump in and talk a little bit about your work, so we can have a sense of the tangible actions that are going on as a result of this process.
Hey everybody, my name is JR, and I'm working, it's called Project Renews, is a grant, and I'll try to be straight to the point as I can. We have an intake form, which I don't know if you still at that, but there's probably 16 things that we ask them about, things that they need: driver's license, housing, mental health, transportation, birth certificates, criminal record expungement, food stamps, and if they're having problem with their stimulus checks, if they need a social security card, if they're needing treatment once they leave, clothing, a family doctor, anything civil court, if they're looking to get an education with a GED, social security benefits, divorce, or family court. And what I've done is I have put together a list of resources for each one of these that I named off. And there's, say, substance use treatment, I've got at least 10 resources. And I've got support groups for addiction. We've put down some of the government assistance, which, there's only one number for the IRS and maybe one or two numbers for Social Security, child support, driver's license. There's a number for food stamps. We have food resources, even though it's not on our paper, I've added it to this. And we've got 18 resources for someone that's needing food or, can't afford food. We've got at least 8 locations for clothing and furniture, low cost to free. Transportation services, which we know in Eastern Kentucky, transportation is by far the biggest issue. We're in this area where, some of these streets are one lane and it's a two-way street. So there's not a lot of room to get any transportation or funding either. So for transportation, I've added at least, there's 2, 3, 4, at least 8 or 9 places for transportation, which we have certain taxis that can provide transportation. Of course, we have Sandy Valley that can provide transportation for medical issues, in which that works off of the Medicaid insurance. You pay for that. In housing, I've got 21 resources for people for housing. And I try to explain to them, your charges, you may not get in some of these, but it don't hurt to call and ask what their process is. Got a couple homeless shelters listed. We don't have many homeless shelters in this area. We got one that's close to here, and there's one in Pikeville. And both of them, they'll only allow like 90 days is the maximum limit that they can stay. And I've added resources there's a homeless program for males in Pikeville. It's a 25-man facility. It's through Mountain Comp. I try to let the guys know that that's an option for them, because most of them getting out of jail, they're going to sleep on somebody's couch. They don't have nowhere to go because they burnt bridges. And there's a lot of them bridges cannot be rebuilt. That's just the way it is. We've got a couple domestic violence shelters we've added to our list. We've added, for employment, we've added a Kentucky Career Center, and of course, Goodwill also. And what I do, I let them know that Goodwill has a program that if they complete the 2-week program, they get a $300 check and a $75 gift card to Food City, which that should be enough to get anybody who want to participate, especially when they're not working, in my opinion. And I've listed mental health, primary care, veteran services, crisis intervention, substance treatment, domestic violence, transportation, case management, developmental and intellectual disabilities, outpatient clinic, supported employment services, healthcare for homeless. And this right here is way more than what our sheet has listed. And so what I do, I try to provide more than just a couple of locations, because somebody might not like this doctor at this office, so they got another option. I don't know. I hope I've covered a lot about what we are doing. And of course, Casey can tell you about how many birth certificates that we've helped get. Of course, we got more than that. It's probably applied, but some of them we can't get in touch with them. They'll leave us phone numbers that either been disconnected or we can't, or no service or something to that effect. And we are getting positive feedback from inmates. We've gotten positive feedback from the jailer, Bear. And of course, you get some of them that say, hey, I'm not interested. And then maybe a couple weeks later, they're trying to flag you down and tell you, hey, I need some help. I need some services. So we will go back and try to pick up for those people, try to assist them with whatever they're needing. Like I say, we are getting positive feedback. Of course, you wake some of these people up. We go over about 10 o'clock in the morning. And of course, there's some of them guys that stay up all night and they want to sleep all day. So some of them are coming up are about half asleep and not really understanding what we're trying to do for them. And then of course, we get a memo that, hey, that person wants to meet back up with you again. So we try to do what we can to assist them and provide them with resources for this local area. And I'm hoping we're going to be able to expand. I think this is a good program. And
How many you met with?
Right now, I've met with over 300 people. I'm going to say around 330 people. Now, you're looking at some of those names that they got released before I got to them. So I still put them on the spreadsheet. So if I go back to jail, I'll put their name in a highlight and let me know that, hey, this person showed up there before. And then, if we're there, we try to provide services. And of course, you're going to get people that's going to decline. They say, I don't need any of this stuff. And, but for the most part, that's a small percentage out of 330. The ones that's either declined or been released, I combine them together. There's probably 30 of them that's been released or declined out of 330, which I think that's pretty good. That's pretty good percentage wise, in my opinion. And like I said, I'm going to turn it over to Casey and let her talk. I'm pretty sure I done bored you guys to death. So we'll let Miss Casey take over.
My name is Casey. I'm an attorney with Apple Red. JR and I work in the same office. So, so to kind of fill you in on our process, JR goes to cold call on these inmates, essentially, is what I'm going to say. You know, he keeps up with the population every day. And we are now at the point where we've made it where we're catching them as they come in. We're not playing catch up anymore. We're ahead of the game now, or JR is. And interviews them and sees what they need. And so, you know, he addresses the resources, and I'm here to address any of the legal needs that they may have. There's a very wide range of things that they need. And there are limitations on what I can do while they're in jail. So we try to work around it. I can't handle a divorce for someone while they're in jail, just as an example. So we have worked with VLAC, which is another section of Apple Red, to start putting on divorce clinics in the jail, which is essentially like a self-help clinic, because a lot of people in jail want divorces. And that's a big barrier to them. That's something that's hanging over their heads. You know, it messes with a lot of public benefits that they're having, things like that. So we are now going into the jail, helping them fill out all this paperwork, filing it for them, you know, getting it filed for them, and doing everything except directly representing them. There's been a lot of positive
I'm just going to hop
feedback.
in, and so VLAC is Volunteer Lawyers for Appalachian, Kentucky. And that's basically the pro bono arm of Apple Red, where we help private attorneys who would like to take some pro bono cases help, but then we also help people with kind of the self-help process where they can do some things in court themselves that, you know, we might not be able to do for them directly here at Apple Red. So anyway.
So that's been a big initiative, is helping them that way, because if these people are serving long sentences, you know, it doesn't mean much to them when I say, call me when you get out. But addressing all their needs, I try to give them advice if that's what it involves, or a workaround we've been doing a lot for tax issues, is getting power of attorneys done for these people, to get their parents to get power of attorney for them, so that they can then talk to the IRS to find out where the stimulus checks are, things like that. A big part of our jobs are making connections, in my opinion. Not only connecting with the people that are in these institutions, but connecting with the employees of these institutions. We are now at the point where the jail staff are asking us to meet with specific people. That's been a big win for us. It makes us feel good, you know. And then now DOC has now started making referrals to me. And then we've been making contacts with local community providers, rehab facilities, and then behavioral health facilities, such as the MAT clinics, you know, medically assisted treatment clinics. So I've gotten a lot of referrals from there. And even if it's someone contacting me thinking they have a legal need and they don't, I can still hook them up with JR and say, hey, do you need resources? My biggest thing is, hey, do you get food stamps? Because if you can get them, why not? You know, you have a need. So that's been our biggest thing, is trying to make as many connections as we can, at least to say, hey, we exist, use us. Feel free to use us when you get out, because the stigma is not just there against these people, these humans that are in the jails. They have their own stigmas. They don't want to ask for help. They struggle to get help from the criminal justice system. So then they, I don't want to say they have a chip on their shoulder, but they just assume that no one wants to help them. And so they don't want to ask for help. Today we met with a guy, and he's a veteran. He was I can't remember his rank. He had a sergeant, I believe, you know, and, you know, he served our country, but he didn't want to ask to use the phone, you know, and then I kept talking to him about things, and he didn't ask for anything crazy. He wanted help getting a birth certificate. And then he kept talking, and I said, hey, do you need a divorce? Because it sounds like you've got a lot going on. And he said, well, yeah, actually, I really would like a divorce. And I was like, well, let's get this going. You know, it's just, I think we need to work on the stigma of not holding it against these people for why they're in there. You know, they have faced things their whole lives that I don't know about. I was not raised in that kind of environment. But I know that, created a cycle for them, for a lot of them at least, that it's hard to overcome that if you weren't provided the resources from the get-go. So many of these people we meet with do not know how to read or write, but they graduated. So the fact that they were able to graduate high school, but they don't know how to read or write, that's really hard to get through. We have to fill out their request for a birth certificate. We tried to get a social security card for someone and it got rejected because they don't have an ID, but they can't get the ID without the social security card. So I think it's a lot of getting rid of the stigma and helping people understand that the system is not easy. It's not that they are failures. It's that maybe the system isn't working for them. So happy to answer any questions.
Thank you so much, Casey. Monica put a question in the chat. How are you all interacting with DPA, Department of Public Advocacy?
So I get referrals from DPA. They refer all the expungement people to me. And then they've also referred for a few other things, but we're just down the street from them. So I know that I used to be a public defender, just to give you some background. So I used to work down the street with most of the same people. So I met with all of them that work in Floyd County specifically initially, just to say, hey, this is what I'm doing now. And then also the prosecutors, they have referred a few people my way. So kind of hand in hand, I guess you would say at this point.
Thank you so much, Casey. Are there other questions or feedback? We have, yeah, Suzanne.
I want to make a comment is that I think everybody could probably see we're seeing some systematic issues that are things that could be easily resolved and not only prevent recidivism, but help all of us. For example, the ID situation, an ordinary citizen, which the law, I think was supposed to be written for, is challenged right now by the way we have to get ID. So I think there's a lot that we're going to gain from this project that absolutely benefits everyone. And that's the thing that's so beautiful about it is it's compassion centered, but it's also bringing out and showing things that are just so many cracks that we have that need to be, we need to step back and evaluate how we do certain tasks.
Absolutely. I think that's a really important observation, that when we help the most vulnerable in our populations, it helps all of us across the board. Absolutely.
I guess I wanted to add, Amelia, I don't think anyone particularly covered the fact that one of the other things we do want to try to do is to set up a bail fund. One of the real serious problems is that many of as you probably heard at the beginning, is that if you look at this very much, is that we've got people in pre-trial who are in our jails who simply are there and haven't been found guilty, as Amelia said, who can't afford bail. And in the last and there is a national bail fund, and we are slowly trying to get enough information together to decide to learn how to be either part of that fund or an independent group to start raising money so that we can get these folks out, especially those who have not been convicted. I mean, they are presumed innocent, and the fact that they're in jail, I'm sure Casey and JR know, or then they lose their jobs and their family lose support and all the other things that happen that could be avoided if they could be back, especially if it's a nonviolent offense and they're there for something fairly minor. So I think many of us want to eliminate cash bail, which is something a lot of places are working on. Federal system doesn't have cash bail, but it's with us, and so as long as it's with us, we feel like we've got to solve it, at least get something started to be able to have a bail fund here and to maybe see it go a little bit beyond Floyd County, but it's important for any of you who want to work on this to have that in mind as well. The other question I just wanted to ask to JR and Casey, for all of us, is as we're learning about these needs that prisoners have, are we looking to the day they're released? I know the stimulus checks could come to someone presently, but are we talking primarily about like food stamps is when they get out? And to what extent? You only mentioned a fairly small number, JR, of people who've actually been released, but as you accumulate, as you inform them about resources, is it all looking towards the day they get out of there? Or
Yes. Yeah. Now the resources that I went over earlier that we have on our intake, it's catered to them for once they leave and once they get on the street, because they have people that are released that has nowhere to go, nobody to call, and they're just stuck. And some of them will go back and they will commit a petty crime just to go back to jail because they have food, they got somewhere to sleep, and especially when it's 20 degrees outside. And of course, every time if they're outside somewhere and then the police stand, they ask them to leave and go somewhere else. And like I say, some of them they'll commit a crime to go back. But yes, the resources that we are providing is for once they leave. One thing we can help them with while they are incarcerated is a birth certificate. That's the one thing Casey and I work toward, to at least show them that this process, it works. Now, basically, well, in a nutshell, I can give them the tools. They just got to use them. That's really what it comes down to. And the old saying, you can lead the horse to water, but the rest is history. But yeah, most of the stuff that we're doing is for once they get out. Because we can't get a birth certificate for them while they're incarcerated, and we can't get a driver license, and Casey can't get on divorce, and there's just a lot of things. But we and I'm always looking for new resources that we can add to this. But does that answer your question, Mr. John?
yeah, I think that's helpful to help people who are here. You might want to let people know what costs are involved, that if you're going to try to help people locally, inmates don't have any money, that even birth certificates and ID cards cost money.
Well, we do explain that to them, that we'll pay for the birth certificate. Once you are released, we will submit for the funding to help you with your driver's license or an ID. And some of them, they're wanting to go to treatment once they are released. And I've got what they call a quick response team. It's one phone number they can call that they can probably get in treatment within 24 to 48 hours.
Just to chime in real quick.
Go ahead.
So for while they're in there now, last week, JR, I was there too, but JR we met with a female the week prior, and she said, I'm homeless. She was as homeless as it gets. She's got no family. She's got no phone number, nothing. She's famous on TikTok, but that's another story. So she said, I need help, but she couldn't give us an out date. They don't normally know their out dates. It's just, they just don't know. But we said, well, we can help you get to a homeless shelter. If you can tell us your out date, we can help you. Well, last Wednesday, we walked in the morning and the jail staff said, she's getting out today if someone will post her bond. So it's a long story. They got someone to come post her surety bond. So JR got on the phone with the homeless shelter, arranged for her to get there, made sure they had a bed. She needed a COVID test. So then one of the guards went home and got one of their free rapid tests they got in the mail, brought it back. The nurse created paperwork for this COVID test and she got there. So, I mean, we haven't had contact with her since, but we have had several that have started contacting us after they're out saying, hey, I lost my resource sheet, or I need something specific. I need this, or some that JR will give me the referral, but I don't make it back to them over there before they're released. So I track them down, and then we continue to provide resources once they're released.
I think hearing from y'all just about the sort of vast number of different kinds of barriers that are stumbling blocks for people upon release, right? And we all agree we want people to serve their time and then come back into the community. And yet we know there are so many barriers. I mean, for example, just the degree to which having an ID is such a significant barrier for folks. That was not something I really had a grasp on. And so you kind of, you cycle of work and then it reveals a whole other set of work that we need to work on, right? So like, how do we expand access to these resources? How do we build out available affordable housing for folks who are getting out of jail and folks who are already out here without access to what they need? So, I think this process all along has been kind of an iterative cycle where we identify a process, we do it, we learn, we identify the next steps that we're going to have to be working on. And so it's really exciting to me when I look at this, just right almost exactly 2 years ago when we started this conversation in Floyd County, to have moved the process to this incredible team of people who are very committed, work together every month to figure out what steps we're going to take, what we're going to keep doing, funded these positions. The positions were themselves pilots and are already proving incredibly well how much value the work has. And I think, as Evan said, it's models that we hope to be able to replicate in other communities and other counties. So this kind of like trickle down, I guess, of pilot models that work that beget other pilot models that work. We're really excited about expanding that, right? Of course, throughout the region. That's part of this conversation here today, get more folks from other counties involved in hearing kind of what the process has been and what we've done, that it is in fact doable. So we're running short on time, shockingly to me. This flew by. I want to take a moment to hear from Dr. Philip Kurd, who's in Jackson County, and we're kind of at the front end of a similar process in Jackson County, just getting off the ground. And Dr. Kurd, if you wanted to tell us a little bit about kind of why this was something that spoke to you and kind of where we're at. And I also have a quick input from Kathy I want to make sure to get to put this in the context of the Rural Development Hub work, because that is a piece that is woven throughout this. So I know we're short on time, but Dr. Kurd.
Okay. It's unusual to have two Kurds on the same, and sometimes, Sandy, we'll have to figure out if there's a connection. I think there is from what little bit I know about you. But I'm from Jackson County, and I'm a member of the Jackson County Community Foundation. And I'm going to try to make this as concise as possible because we can always expand on it. But the Jackson County Community Foundation has been going now for, I'm going to say about 10 years, and I've been on the board for maybe 5 years. In the past, we've done projects to support beekeepers, tourism, food banks, farmers market, the COVID economic strain. And last year we did, working with Brushy Fork, we did our strategic plan. And there were two elements of that plan that we haven't addressed yet. And one is to do something to address the needs of felons. And the other is to look at what students need, and specifically an after-school program. So about that time, we became aware that the Foundation for Appalachian Kentucky could have some funding to help us in that area. And so I reached out to several other board members, one and her husband, who served the county for many years in terms of social work and working with children, a banker, a retired school teacher who's now doing counseling services. And so we got together and primarily we thought what we needed to look at was what the Floyd County people are looking at, but also to go upstream and say, where do these people come from? Our county paper, our weekly newspaper, every week has mugshots. You can look at those mugshots and think, oh, certainly they are the underserved and the vulnerable. But it's also, they at one time were children. And so I think going upstream means we have to look at what's happening early childhood on. And we have to look at this as a continuum. And we have to look at it beyond compassion. We have to look at it as what's in it for the community. If you can not have people end up with their mugshots in the paper, or if you can end up with someone either never having gone to prison, never having been incarcerated, never having been justice involved, then there's a good chance that they're continuing to be contributing positively to the community. So beyond compassion, it's a matter of looking at what you can do to turn something around 180 degrees so that the community benefits. So it's the community doing something for its own self-interest, not just to give aid to people who've ended up with their mugshots in the local paper. Along with that, it's important to say the vast majority of people in Jackson County do not end up incarcerated. But what we do have to look at is that, and then along with that is the thought, maybe there's something that could be done. And of course, in Floyd County, we know now that there is. But when I first started looking at this, I thought, gosh, do we really know that there's anything that can be done? And what is it? We may have to turn to Brushy Fork or to the foundation, to Amelia, or to the Mountain Association, some organization that could bring some research potential to begin looking into even, what can we do besides emulate what's happening in Floyd County. So, but in the meantime, I just started doing a little research online. It was amazing. And this was starting in February. So first of all, we're very early on. And second of all, it's amazing what we have learned. And I'll go into that in a minute. They just, first of all, the foundation said, yeah, we have Amelia Kirby, and I think she might be able to work with you. And we found that to be true. So that is the background. And so as I said, we gathered a group of people who were already affiliated with the foundation, our local foundation, our affiliate. And we thought about what are the first steps. So we thought, well, before all sorts of rumors started flying about what we're doing, we better meet with some of the community leaders. So we've met with the county judge, and we had a good reception with him, and some ideas already popping up in terms of, we have a vocational school in the county, and perhaps there could be some tie-in between the vocational school and the inmates, the felons. So we had that meeting, and then we had a very good meeting with the jailer, and we got the sense that the jailer is ready to move forward with some of the things like what JR has been talking about. And I think that at this point, what's happening in Floyd County, there may be some reception. If nothing else, if JR would share his questionnaire with the jailer so that he might know where to turn. He's already doing quite a bit of trying to intervene. He has a lot of compassion for the people who are incarcerated under his care. But I think there's a lot that can be done there.
Dr. Curran, I hate to interrupt you. but as we're coming right up on our time, I don't want to
Okay,
linger. People past what we agreed the time cutoff time was. But if I could chime in just real quick on your
sure.
work that y'all have been doing, one of the things that it really has revealed, because as you're looking at the upstream, as you described it, it really speaks to us about how many different avenues there are into this work, and that there is not just one model. There's so many different approaches to really engaging with the issue. And we're really excited about all the different kinds of creative possibilities that are emerging. I did want to, as in our last few moments, make sure we touch on the Rural Development Hub, because that's such a key part of the work that y'all have all been doing together in the region. Kathy, if you could just give us the briefest of overviews on that.
Okay, I'll try that. Well, really, we're just seeing this work as a model of Rural Development Hub, and I'll just read that. I know we did a session on the Rural Development Hub a few months ago, but I know some people may not have attended that. So I'll just give a brief definition of what a Rural Development Hub, and you can see how that falls right in line with the work that we're doing in the criminal justice realm. A rural development hub is a place-rooted organization working hand in glove with people and organizations within and across the region to build inclusive wealth, increase local capacity, and create opportunities for better livelihoods, health, and well-being. Hubs focus on all the critical ingredients in a region that either advance or impede prosperity. They work to strengthen those critical components and weave them into a system that advances enduring prosperity for all. So you can see how the affiliate community foundations working through the criminal justice system is right in line with the Rural Development Hub. I mean, they provide the boots on the ground for inspiring action and helping to transform the city or the county or the region. So hopefully that just kind of resonates with everybody. And you can see, I know in a lot of the places where development is being done differently, it's the rural development hubs that are typically leading those efforts. So we wanted to lift that up and show how the affiliate community foundations can lead that charge in communities. This is, like Amelia said, and Philip and everyone else said, this is an area that we had not been used to before. So we've kind of taken that effort, and I think that's all in because of the leadership of the boards of the affiliate community foundations.
Thank you very much. And it is, these issues, so many different issues are interwoven through the criminal justice system, and it's a way to think regionally about how do we tackle a lot of different kinds of stuff. So I really want to thank all of y'all for your time and your expertise and your participation in this conversation today. I put my name and contact info in the chat very belatedly just now. And I'm always happy to continue the conversation. I'm really excited about the work that's emerging, and I'm looking forward to talking more with everyone here. Thank you so much.